Welcome to the UC Quits webinar, How Nurses at the University of California Can Address Tobacco Dependence, presented by Dr. Linda Sarna. My name is Catherine Saucedo, Deputy Director of the Smoking Cessation Leadership Center at UCSF, and I will be your moderator for today's webinar. This webinar is designed to educate nurses on tobacco cessation and health systems change. The UC Quits project aims to further reduce tobacco use and exposure, the leading cause of preventable death, by developing a UC tobacco cessation network and e-referral system with the California Smokers Helpline. Headed by Dr. Eliza Tong from UC Davis, this ambitious project involves all 5 of the University of California Health System Sciences campuses to ensure that every smoker receives support at every encounter. This system-wide collaboration is a historic change in how healthcare providers can ensure that smokers can get help to quit smoking by using the electronic healthcare record. Learn more about UC Quits at www.ucquits.com and the California Smokers Helpline at www.nobutts.org. Now I will introduce today's speaker. Dr. Linda Sarna is Interim Dean, Professor, and the Lulu Wolf Hassenplug Endowed Chair in Nursing at the School of Nursing, University of California at Los Angeles. Dr. Sarna is internationally recognized for her work with promoting nursing involvement in tobacco control and in oncology nursing research focused on quality of life and symptoms of patients with lung cancer. She is the nurse champion for the UC Tobacco Cessation Network. And now for Dr. Linda Sarna on how nurses at UC can address tobacco dependence.
Thank you, Catherine. Hello, everyone. The objectives of this webinar are simple. I'm going to first provide an overview of the UC Quits project. Then I'm going to discuss the health impact of tobacco use and exposure to secondhand smoke, review the important health benefits of quitting, and importantly, describe what nurses at the UC can do to support quit efforts. This project, as Catherine mentioned, is very important. It's rather historic in binding all of the UC hospitals, UC Davis, San Francisco, Los Angeles, Irvine, and San Diego together so that we can take action to address tobacco use at every encounter. There are tools on the website that will be very helpful for you and your patients, and we'll review some of these during the webinar. The California Smokers Helpline at UCSD is going to be providing the free counseling and follow-up services that are linked to UC through the electronic health record. The aims of UC Quits are to build capacity through the University of California with a UC-wide tobacco cessation network. We've created technological modifications to the electronic health record that have involved both an automatic referral to the California Smokers Helpline and special order sets and alerts. We've been conducting outreach and education across departments and professions, and importantly, to the nursing staff. These are just a few of the many, many people involved in the UC network. Eliza Tong, again, the project director. But at every single campus, there are people, many of whom are not pictured, that are involved with this project, including many nurses. When we began our project, we decided to have an evaluation of how well we were doing in actually delivering smoking cessation as documented in 2012. And you see that we had definitely ways to go. Some of this, of course, might be limited by the different documentation extraction methods, but still it demonstrated that we needed to do a much better job in providing intervention support for smokers at UC. Nurses can play a very important role in helping smokers quit. As the largest group of healthcare professionals, of course, we have numerous encounters with patients. And although the evidence about the dangers of smoking is well known, we also know now the effective ways to help people quit. 70% of smokers want to quit. However, too few clinicians are prepared to address this chronic illness, tobacco dependence. So this webcast is going to provide some evidence about the best ways to help patients quit, with a focus on the role that nurses can do. Remember, smoking is not a lifestyle choice or an individual choice. It is a disease with defined etiology, nicotine dependence, and symptoms. The nicotine in cigarettes is highly addictive, and quitting smoking is difficult. In 2014, the Surgeon General report summarized the 50 years of progress about what we've known about tobacco and health. Over 20 million people have died prematurely from smoking. We know that smoking causes diseases in nearly every organ of the body, to diminished health status, and causes harm to the fetus. We also know that exposure to secondhand smoke has also been causally linked to cancer, respiratory, cardiovascular diseases, and adverse health effects in infants and children. This is important because as part of our program, we're also going to be trying to assess exposure to secondhand smoke. We also know, importantly, because nurses are predominantly female, that disease risks for smoking by women are now equal to those of smoking by men with lung cancer, chronic obstructive pulmonary disease, and cardiovascular disease. Well, much has changed in the decades since the Surgeon General report, as the next few slides will show you from advertisements by the tobacco industry in the 40s and 50s and 60s. This first one, "Gee, Mommy, you sure enjoy your Marlboro." And the mother says, "Yes, you need never feel over-smoked. That's the miracle of Marlboro." And here we have one, yes, sir, here's your baby." This Philip Morris ad, this mother lovingly cradling her new infant, within the corner the Philip Morris cigarettes, which at the time were fresh and unfiltered, is particularly terrifying, as is this family photo of for L&M cigarettes with daddy smoking surrounded by young children and family members. Now the role of nurses was different then too. In this slide from a cover from the Saturday Evening Post, we have a nurse lovingly lighting a cigarette of a soldier, probably in a submarine if we can judge by the window. She's probably trying to treat this soldier's nicotine dependence symptoms, which we will discuss. And then, of course, nurses, along with physicians, were also used to advertise cigarettes. It might be helpful as we talk about what nurses can do to reflect on the changes in smoking and tobacco trends in the California population in the last 2 decades. The yellow line shows cigarette smoking, where it was above 15% in 1996. You see some drift down, a little dip in 2008, and then it seems to be plateauing in 2011. So even with all that we know, about the devastation of tobacco use, we still have people addicted to nicotine. We still have work to do. You'll also see these other tobacco projects, both smokeless tobacco and dual users are important. Note that this slide does not include electronic cigarettes, which some people are now using to substitute to try to quit, even though they are not approved by the FDA. This slide shows smoking prevalence by age and gender. Of particular concern, of course, is among the young population. You'll see across this histogram more men smoke than women, but in men 25 to 54, look at above 20%. Of course, this is a time when there are young people in the household, and we need to pay attention not only to the smoking among men and women, but also the exposure to secondhand smoke. We also know from the literature and also from our data from California smokers that smoking does track with poverty, so that people who are more impoverished have higher smoking levels, and that means that they have limited resources to help with smoking cessation. This is important because the smoking cessation the California helpline is a free resource. We will also see from this slide that smoking tracks with educational level, that those people with less education are more vulnerable to smoking and nicotine addiction. The good news is that people do want to quit, and the percentage of smokers who've made a quit attempt in the past year in 2011 was approximately 61%. So people are out there trying to quit. However, we also know from the literature if people make an unaided quit attempt, only 3 out of 100 will be smoke-free 1 year later. That's why we want to provide an evidence-based intervention. I can't emphasize enough both the immediate and long-term health benefits of quitting. If we look at this slide, just within the first couple of weeks and months of quitting, there are dramatic changes in lung function and lung cilia. Smokers start to feel better, their coughing, fatigue, shortness of breath decrease, circulation improves. After 1 year of quitting, the excess risk of heart disease decreases to half that of a continuing smoker. After 5 years, the risk of stroke, a devastating illness, is reduced to that of people who have never smoked. Lung cancer rates continue to be higher than never smokers, but they are lower as people are able to quit smoking. And long-term, it does decrease the risk of cancer of the mouth, throat, esophagus, bladder, kidney, and pancreas, which would increase if people continue to smoke. After 15 years of being smoke-free, the risk of heart disease is similar to that of someone who has never smoked. This slide about tobacco dependence illustrates that it's a two-part problem. It explains why it's so challenging for people to quit. Tobacco dependence is a chronic brain disease that has physiological and behavioral components. Smoking cessation interventions that address both will be the most effective. Prolonged use of tobacco results in dependence, which is characterized as a physiologic dependence, the addiction to nicotine, as well as the behavioral habit of using tobacco. While medications can help with the addiction to nicotine, as is discussed in another webcast in this program, the behavioral component can be treated through behavior change programs, such as individualized counseling, group cessation methods, support through the telephone quit line, such as the California Smokers Helpline. The clinical practice guideline, which has summarized over 6,000 published articles, advocates the combination of both behavioral counseling and pharmacotherapy in treating patients who smoke. So what can UC nurses do to support the Project UC Quits and to provide patients with tobacco dependence treatment? Well, first is ask and document tobacco status. This sounds pretty basic, but we still need to do a better job in identifying all smokers in our system, both in inpatient and in outpatient settings. We also want to go beyond just identification of smoking status and actually provide support for treatment We do have resources, which I'm going to describe, including referral to the quit line. This slide illustrates the range of health record modifications across the UCs that are going forward right now. The P means in process. So you can select your individual campus and see where you're at in terms of e-referral to the helpline, the outpatient order set, the health alerts, whether or not there are classes available, the inpatient order sets, and also alerts and links, and inpatient education. Nurses, of course, are responsible for supporting all of their patients in quit efforts. But at some institutions, there are other healthcare providers, particularly respiratory therapists or pharmacists, as well as physicians, who are involved in the inpatient education. So whether the nurse is directly delivering the first-line treatment, nurses are particularly important to make certain that that intervention is done. Tobacco history screenshot may vary campus by campus, but all of the screenshots now identify whether or not someone is a smoker, the type of tobacco use they're utilizing, whether or not they're ready to quit, and they may have additional characterizations about whether or not they're an everyday smoker, a light smoker. I will say that even if patients select that they're not ready to quit, every smoker deserves the information about when they are ready to quit. There are two places to document on the tobacco history or patient education record. You can provide information about when counseling is given. In some UC sites, they may also provide specific talking points about how to ask patients about tobacco use, how to educate them about the importance of quitting, learner readiness, and whether or not education materials have been downloaded or delivered to the patient. The 5 A's of tobacco dependence treatment is the gold standard. That's asking about tobacco use, advising tobacco users to quit, assessing their readiness to make a quit attempt right now, assisting them with a quit attempt, and arranging for follow-up care. Each of these components is important. However, in this webinar, we're also going to discuss an abbreviated intervention that every nurse can use as part of their day-to-day care. I think I need to emphasize that offering medications to relieve nicotine withdrawal during hospital stay is very important. I want nurses to consider that nicotine withdrawal symptoms are similar to having patients in pain. We do a very good job right now about assessing and treating pain, and I'd like nurses to consider that nicotine withdrawal also hurts and to provide opportunities for treatment in the same way. A patient who smokes and enters the hospital can experience nicotine withdrawal if they're in an environment that doesn't allow smoking. There are medications that can help with these difficult symptoms, and you can discuss this with the physician as well as with the patients so that they do not need to suffer during their hospital stay. One thing we also know is that if they're able to go tobacco-free for a number of days while they're in the hospital, even if they aren't interested in quitting smoking previously, they may have a positive experience about what it's like to be tobacco-free, which may help them in a future quit attempt or help them stay tobacco-free long-term. The abbreviated version, Ask, Advise, and Refer, takes advantage of the California Smokers Helpline. This is an important and valuable service that can allow intensive support for the patients. Remember, the gold standard for smoking cessation is both support and pharmacotherapy. They can also arrange for that long-term follow-up that is so important after the patient is discharged from the hospital. But even for Inpatients, well, inpatients, the referral is important, but for outpatients, during a very busy clinic day, if you do not have an opportunity to engage in the full discussion of quitting, referring patients to the quit line will be very important so that they can have the additional support. What can nurses do? Well, first is to ask about tobacco use. This is becoming normalized. It's what patients expect their health care provider to do. You might ask, do you or any member of your household use tobacco? Or we like to ask our patients about tobacco use because it has the potential to interact with medications or it contributes to many medical conditions. Again, asking is incredibly important and should be part of your routine care. Advising tobacco users to quit. One of the most important things that you can do as a healthcare provider is to let patients know that quitting is important, and as I emphasized earlier, quitting can make a difference in their health status. There are medications that patients can use to help them in the quit effort. Many people may have had experience in a quit effort before, but perhaps they didn't use medications or didn't receive social support. Also, it's important for patients to know that it's not uncommon for patients who use tobacco to make several quit attempts, perhaps as many as 6 to 10 quit attempts before they're able to be tobacco-free. You might tell them that you're happy to help them receive the assistance that they need to quitting tobacco in order to be more successful. Each campus has approved resources that they can hand out or provide their patients in the outpatient and inpatient settings. Because I'm from UCLA, I decided to provide the examples from UCLA. So here you see one is an example of first our smoke-free campus. All of our campuses on UC, of course, are smoke-free, but we want to alert both the patient and the visitors about this. We want to let them know that there are medications that can help with withdrawal symptoms and to talk with their family and friend about making a quit plan. We want to let them know about the California Smokers Helpline that can provide them with the counseling, support, and medications. And also we have a very abbreviated flyer about these FDA-approved medications, many of which are available over the counter so that they can purchase the patch, the gum, and the lozenge after they leave the hospital. So, these are short-acting. Some require medication. The nasal spray, the inhaler, the varenicline, and bupropion require loading doses, so they're not good for acute treatment of nicotine withdrawal symptoms. We also provide our patients with an action plan for quitting because it's more than just putting on a patch. It really is about getting ready, thinking through their quit effort, getting the support and encouragement that they need, learning the skills and behaviors for being tobacco-free, and also understanding the role of medications and how to use them correctly. One of the most exciting part of this project is the e-referral to California Smokers Helpline. Now, the California Smokers Helpline has been around for a while, but in the past, patients had to call them in order to get help. Now we're going to have an electronic referral so that those patients who are interested will get that call within 1 to 2 days after discharge. And also there will be a feedback loop so that the encounter results will be sent back to the ordering provider and to the chart so we can see whether or not patients were contacted and whether or not they were able to make a successful quit effort. These free counseling services are available in multiple languages. There are flyers that are available. What happens at the first quit line encounter is that the trained supporter will provide them with materials that will be sent to their home. They will also provide an in-depth assessment of each smoker's individual story and what might work best for them. Again, the number 1-800-NO-BUTS. You can see in this slide how well we have been doing in terms of our e-referral since the project started. These data are as of October 2015. We've had over 2,000 referrals. We've been able to reach almost half of those referred. You know, in today's telephone age, it's challenging whether or not it's the cell phone or the home phone and how frequently these numbers change. Of those people who were reached, over half of them did receive counseling. We will eventually, of course, be having the data about quit efforts, but we don't have all of that yet. I wanted you to know that in addition to this brief webinar about the importance of nursing involvement, there are also other webinars that provide free CEUs. And these are review reasons for having your patients quit smoking, the 5 A's, a more intensive overview of the California Smokers Helpline. The details about pharmacotherapy and smoking cessation might be of particular interest if you're unfamiliar with those medications. How to address secondhand smoke, which is very important, especially for families of children leaving the hospital, but really for all. Upcoming are going to be slides about webinars about e-cigarettes, and of course you're just having this one now about the nurse's role. So I want to thank you for your attention. As the largest group of healthcare professionals, over 3 million nurses in the United States, nurses can make a profound difference in reducing death and disability due to tobacco use. Many patients make a decision about quitting in the hospital or quitting at their outpatient encounter, and you can help support those efforts. You can make a difference. Thank you very much.
Thank you, Dr. Linda Sarna, for your presentation on how UC nurses can address tobacco dependence. Free CME CEUs of up to 0.5 credit will be available for those who complete this online activity. The webinar link and instructions to claim credit is posted on the UC Quits and CME California website. For questions on the UC Quits project, please contact Dr. Eliza Tong. You'll see her email on the screen. And thank you all for your time.